advocating for language access, because as we speak about the Department of Health in Wyoming, we do believe that healthcare is a human right, and therefore access to health is a human right. But we have also seen that since COVID-19 started, we have had even additional barriers and challenges that have increased health disparity. The second guiding principle is the compliance with the language access policies. They are not only a civic obligation, but also a legal obligation. And even though people can say, well, what do we care? Well, the problem is the law, and the law has not relaxed at all, not even during these times. I also, like, from a human standpoint, believe that when someone truly cares about you, they make an effort and not an excuse. So again, this is in our civic and legal obligations to provide these services. Just to remind you very quickly what the language access policies are, I am just listing a very short list. The list goes on and on. They are policies that mandate that everybody that doesn't speak the host language, and in our case English, have access to the provision of language services. It can be an interpreter over the phone, can be a volunteer that speaks and is trained in interpreting services, can be a flyer or a handout in the language that they speak. So I am going to go over very quickly, because I am sure that you are very knowledgeable about all these laws, but I'm just going to be glancing over some of the most important. And obviously, the one that is really the basis of the history in the United States is Title VI, and the executive order that was ratified several years ago is 13166 by the former President Clinton. Now, Title VI says that no person in the United States shall, on the ground of race, color, national origin, be excluded from participation in or be denied the benefits of or be subjected to discrimination under any program or exercise receiving federal financial assistance. Briefly, what that means is that any organization that is receiving financial support by any federal program is mandated to provide language access to all those that are in need. And specifically for our case, the wording that covers this covenant is given by national origin. Now, this mandate was then ratified under former President Clinton with Executive Order 13166. The executive order is published online, both in English, and there is an official version in Spanish as well. When the executive order came out, the denomination or the acronym of LEP became very common, and LEP stands for Limited English Proficient Individual. So any LEP person has the right to be provided language assistance in order to access, in our case, health services. The national CLAS standards are also extremely important, and they are standards that go across several layers or levels of any healthcare administration. However, there is a specific section within the CLAS standards that are specifically defined or identified to cover communication and language assistance. And within the standards is number 5, number 6, and number 7. And this is exactly what also the Joint Commission is going to use when they go and audit the healthcare organizations that they cover. And you can also go to the Joint Commission latest publication. You will find that they all refer to Title VI, the executive order, and the CLAS standard. And in 2012, they stated very clearly that you shall not penalize those that do not speak English. Lately, what has even given more strength to these policies is the Affordable Care Act, and particularly the section 1557 that covers the non-discrimination in health programs and activities. These are all laws that you should have a very present, and the compliance officer that works in our organization should make these policies as part of their roadmap to continue to be in compliance with the law. What are the consequences if any of these policy is violated? Well, first of all, the Department of Justice is going to assess any complaints that they receive, and they are also going to investigate in order to make sure whether or not violations have been made. One thing that is very important to underline, to stress, is that with the Affordable Care Act, the law puts much more burden on the provider to prove that they did all their due diligence. In other words, the burden is more on the provider to prove that they did what they were supposed to, rather than on the patient or the complainer demonstrating that they did not receive the services.